So psychiatric mental health nursing, we are talking. And here the some pharmacology therapies and tricyclic antidepressant. Here we are going to talk what are the tricyclic antidepressant medication, indication, mode of action, side effect, and some key points. So, tricyclic antidepressant or antidepressant block the reuptake of norepinephrine at the presynaptic junction, and it is used to treat the depression. So norepinephrine or epinephrine is actually neurotransmitter, right? So this medication work on neurotransmitter. So the common indication of antidepressant, definitely if you read the name, you can get some ideas. We use it for depression, some neuropathy, or fibromyalgia, muscle pain, or anxiety, and also we use for insomnia. So may reduce the seizure threshold, involuntary muscle movement. Seizure precursor is very important if your patient have it. May reduce the effectiveness of hypertensive agents. So if your patient take blood pressure medication and if your patient need to take tricyclic antidepressant, it is important to monitor blood pressure. So concurrent use of alcohol and antihistamine can cause central nervous system depression, and concurrent use of monoamine oxide inhibitor can cause hypertensive crisis. This is the question NCLEX board asks. So TCA and monoamine oxide inhibitor together is a dangerous. It can cause hypertensive crisis. So toxicity can occur, and all clients should undergo electrocardiographic evaluation before treatment and periodically thereafter. So overdose is life-threatening. Immediate treatment is important, and also TCA or tricyclic antidepressant like clomipramine may use to treat obsessive compulsive disorder. The next page, we are going to say some of the medication name we use. First one, amitriptyline, then amoxapine, clomipramine, desipramine, imipramine, nortriptyline or protriptyline, and trimipramine. So if you feel all name is difficult to remember, at least you have to remember amitriptyline or imipramine, most popular medication we use. So it is, I said, amitriptyline. So triptyline over the tricyclic. It is actually 3 bond together. So next go, if your patient take tricyclic antidepressant overdose, as a healthcare provider, what we will do? We check the airway and maintain the patient airway, admin oxygen, check the vital sign, obtain electrocardiogram, prepare for gastric lavage, prepare for admin, physiostigmine. This is the antidote, a cholinesterase inhibitor, right? And also anti-dysrhythmic medications. Document the events, action taken, and client response. There's few more priorities. TCA overdose can be life-threatening. The sign and symptom include dysarrhythmias, and dysarrhythmia lead to heart failure. It might be included tachycardia, intravenous blockage, heart block, complete arterioventricular block, and ventricular fibrillations, hypothermia, flushing, dry mouth, dilation of pupil, and confusion. Sometimes agitations, hallucination, seizure, followed by coma. So if we do not take any action, lead to the death. Immediate action is to check the airway and also institute the measure such as oxygen to maintain an adequate oxygenation level. Vital signs are checked and monitored, and electrocardiogram is obtained to check for dysarrhythmias. Gastric lavage with activated charcoal is done to prevent further absorption of medications. The physiostigmine is given to counteract anticholinergic effect, and antidepressants are administered as needed. The nurse documents the events, action taken, and the client response. What are the other side effects? Anticholinergic effect. So dry mouth, difficult avoiding, dilated pupil, blur of vision, decreased gastrointestinal motility, and constipation. So all together we call anticholinergic effect. But it not necessarily every patient have every side effect. Photosensitivity, cardiovascular disturbance such as tachycardia, dysarrhythmia, and orthostatic hypotension. Means when patient change the posture, blood pressure drop. So as a healthcare provider, we tell them slowly change to the posture. If he or she lying down, tell them to sit in a corner of the bed, edge of the bed, and from lie to sitting and sitting to stand up. Sedation, seizure, weight gain, anxiety, restlessness, and irritabilities. Decreased or increased libido with the ejaculatory and rejection or erection disturbance. So the most of the medication, antipsychotic medication, has a chance to develop dependency, addiction. In the same few times when they took the medication, they feel good, their excitability increase, their performance increase, but it is a long-term bad effect over the body. What else? Monitor the suicidal client, especially during the improve the mode. So, and also client instruct the change of posture slowly to avoid hypotension crisis. So it is very important if any patient has a suicidal ideation, we have to give the priorities. And also every healthcare provider have to know what are the signs of impending suicide or what are the priority to work. I said, ask your patient directly, have you thought about any kind of harming or killing yourself? If patient say yes, assess the patient plan, and if they have the means to carry out that plan, access to the farm, right? So most commonly action are, it's called implementation one-to-one observation. Do not assign the patient to a private room. This is the NCLEX book asks the question. Monitor the pattern of daily bowel activity because TCA can cause constipation, right? So as a healthcare provider, we encourage to take intake fluid, courage for ambulation, and courage for fiber containing food. Also for the client on the long-term therapy, monitor liver function and renal function test. Administer the food and milk if the gastrointestinal distress occur. Admit entire daily oral dose at one time and preferably at the bedtime because of sedation effect. The client is instructed to avoid alcohol or non-prescribed medication to prevent adverse medication interaction. Particularly, it is good to take TCA and monoamine oxide inhibitor not together, because MOA increase the effect of serotonin and norepinephrine in the central nervous system. The client is instructed to avoid driving or other activity required alertness until the response is known. Sedation is expected in early therapy and may subside with time. When medication is discontinued by the primary healthcare provider, it should be trapped gradually. The potential for medication interaction with over-the-counter cold medication exists. The client is cautioned about photosensitivity and to take measures to prevent exposure to the sunlight. Intervention, good oral hygiene, and the use of hard candies and mouth raises to relieve the dry mouth are encouraged. Psychotherapy is also encouraged. The client is informed that the antidepressant medication may take several weeks to produce the desired effect. The client's response may not occur until 2 to 4 weeks after the first dose.